Hi, this is Dr. Clay Brooks with Real Medicine. And today we want to talk about the Philadelphia Phillies, the first place Philadelphia Phillies, and we want to talk about Zach Wheeler's upper extremity blood clot issue. Will this derail his career? And will this derail the Phillies' hopes for upcoming playoff berth? Let's get into it. So the Philadelphia Phillies are currently in first place in the NL East at the time of this recording. With roughly 40 games to go in the season, they may have suffered a setback because one of the starting pitchers, Zach Wheeler, has been diagnosed with an upper extremity blood clot in his right arm, which is actually his throwing arm. So we'll get into that in a minute here. Currently, the Phillies at the time of this recording are about 5 games ahead of the Mets. So they're doing very well, but obviously losing a starting pitcher can be an extreme blow to your potential season. So let's talk about that. So who is Zach Wheeler? Zach Wheeler is a 6'4" right-handed starting pitcher for the Philadelphia Phillies. His current record is 10-5 with an ERA of 2.71 or 2.71. He's been placed on a 15-day injured list or the IL, diagnosed with a blood clot in his right upper extremity. So, what is a blood clot? Let's get into the medicine of this. So, what is a blood clot? And why does clotting matters? So your blood actually is supposed to clot under the right circumstances. So in proper situations, if you get a paper cut or you get a cut of some from some other source, you want the bleeding to stop, right? Because if the bleeding doesn't stop, you'll bleed out and you can't lose all of your blood. So yes, we want the blood to clot. You know, another time when we'd like the blood to clot is if you're having surgery. When we're in the operating room, you know, we cut the tissues, we move things around, and there's bleeding, but we also expect that blood to clot. Again, if you lose too much of your blood or you lose all of your blood, that can be fatal. So, of course, we want blood to clot. So, there's something called the clotting cascade, also known as the coagulation cascade, which is a series of enzymatic reactions that leads to the bleeding being stopped. So, it's very important that the bleeding stops. Now, there are people with genetic abnormalities who can't clot appropriately. They have a disease or a diagnosis called hemophilia. And hemophilia is a genetic disorder. As I stated, when the blood clots, it goes through something we call a cascade, where a bunch of enzyme reactions occur with proteins in your blood that start the clotting process. Well, a person with hemophilia, they lack the proper enzymatic reactions and proteins to cause this to happen. And these people have to get transfusions or other treatments to actually replenish those things that they're missing, these clotting factors, which are proteins that are needed to help these people clot. So that's a genetic abnormality called hemophilia that you may have heard of before. So the question is, are blood clots good or bad, right? We want the blood to clot, right? Because if you cut your finger, you want it to stop. But at the same time, if a person has hemophilia and they don't clot, they're at high risk. The risk of what? Well, if they, you know, get internal bleeding from a injury or, bump their head and they start to bleed in their brain, these things can be problems. So is clotting good or bad? Well, context matters, right? You want the bleeding to stop if you cut yourself, but you don't want to bleed uncontrollably either. So we need the blood to clot, and we need it to clot sometimes just to stop things from bleeding. But in Zach Wheeler's case, this is not a good thing. We don't want to have the type of blood clots that it's been reported. So here's some reasons why you may get a blood clot. You could have a genetic predisposition. There are some people who have a disease called factor V Leiden, where they don't have the proper setup of the coagulation cascade and they get blood clots randomly. That's not good. You can have something called a prothrombin gene mutation. Not good. So you can have a genetic abnormality where you don't clot, and you can have a genetic abnormality where you do clot, but you clot in the wrong circumstances. Trauma puts you at risk for a blood clot, like a fractured extremity, broken arm, broken leg. Cancer increases your risk of blood clots. And immobilization, not moving too much, puts you at risk for blood clots. It's the reason why we often encourage patients who have long plane rides, long car rides, get up, walk around as much as you can. You're on a plane, if you could walk the aisle, use the restroom. If you're on a long car ride, taking frequent breaks, getting out, walking around. You can take medications before these long trips, compression stockings, things of that nature. We see it in the hospitals often. It's one of the reasons that we recommend quick and immediate mobilization after surgery. I recall a close family friend of mine had surgery, and within an hour of being released from recovery, we were up walking the patient, and they thought it was so cruel, like, oh my God, I just had surgery. Why are you walking me? This is painful. They didn't understand we were trying to save their life. In fact, when we were in medical school, that was one of the jobs of the medical students to walk the patients because, it's only so many nurses, therapists are limited, and we need people to get up. We need them to walk. Why? Because we didn't want them to have blood clots. So lying in bed for too long increases the risk of getting a blood clot. So mobilization is very important, and immobilization is a risk for blood clots. So the question is, are blood clots dangerous? Yes, blood clots are dangerous. Now think about arteries and veins as highways to carry your blood, or they're like pipes in the walls. They have two different functions, although they carry blood, but they have two different functions in a sense. Arteries take blood away from your heart. So your heart pumps the blood, goes through the arteries, and it goes to all your organs, to your brain, to your extremities, and things of that nature. Veins are on the opposite end. They carry all the blood back up to the lungs and then through the heart. So the lungs must reoxygenate that blood so that the blood goes to the lungs first. Oxygen gets dumped back into the blood. Then the blood goes to the heart. The heart pumps it back out to do its particular job. So those lungs are important to reoxygenate. But for the purpose of this particular talk, we're going to focus on clots in the veins, specifically clots in the veins. So that's where we want to focus. So what are the symptoms if you get a blood clot in a vein? You can have localized swelling. For example, if you were to have a clot in your calf, sometimes you can see swelling in the calf. It can be painful because if the blood is clotting, that means the blood is not flowing. So it may be a little bit of a backup, and that may cause some local pain. It may be warm to the touch. A lot of blood accumulating in one place can increase warmth. But the danger is if you start to experience shortness of breath. Well, why would you experience shortness of breath? Because a blood clot, although it may be in one particular location, the thing we're worried about is that blood clot propagating to the lungs. If it propagates to the lungs, and then it may get lodged in the lungs, it may block airflow. That's why you may be feeling short of breath. So this is the reason that blood clots are dangerous. So they may be painful, they may cause swelling. That in of itself is not a danger. Just having a blood clot that causes pain and swelling, although not ideal, we don't want to get those, but that's not what makes it dangerous. What makes it dangerous is when it travels to the lung. At that point, it's not just called a blood clot, it is called a pulmonary embolus. Pulmonary for lung, embolus is something that's lodged into that area. And these blood clots are typically divided into SVTs and DVTs in general. SVT would be what we call a superficial venous thrombosis. Superficial meaning like a superficial vein. You can see sometimes, depending on if you have fair skin or you have very big veins, you can see those veins underneath the skin. Versus a DVT, deep venous thrombosis, where the vein is deep inside the body, something you can't see with the naked eye. So if the if the blood clot travels to the lung, it's now called a pulmonary embolus or a PE. And at that point, the size and location could determine the risk and the severity. And if you get the PE or the pulmonary embolus, that may lead to the patient being short of breath. The patient may even pass out, and potentially it could cause death if it's severe, like something we call a saddle embolus, which is a very big clot in a very, very bad location. So as I stated, you can have a DVT, which is a deep venous thrombosis, and you can have a SVT, which is a superficial thrombosis. And that really determines the location in which vein is it located. Is it one deep or superficial? Now, how do you treat it? Well, again, depends on the location of the clot, depends on the severity of the clot. The treatment can be as benign as just pure observation. There's some school of thought that a superficial venous thrombosis, say for example in the upper extremity, may be just observed because there's a school of thought that teaches the risk of propagation or traveling to the lungs is relatively low compared to something like a deep venous thrombosis in the lower extremity that's above the knee, for example. So that school of thought differs, and you may need to talk to a few specialists to get a more detailed analysis of that. Beyond observation may require blood thinners. Blood thinners can be in the form of injections. You can inject blood thinners into the body. It may be in the form of oral medication, a pill you may take to thin the blood out and to decrease the risk of severe complications from the blood clot. Or it may go to a procedure called a thrombectomy, removing of the thrombus, where you actually go inside of the blood vessel and actually remove the clot. So what does this mean for Zach Wheeler? Well, that'll depend on the type of clot that he has, depends on the location of the clot that he has. It's only being reported as a upper extremity clot. They haven't given any specifics on the severity or any detailed location. So what it means for this young man will remain to be determined until more information comes out. If he returns to action after the short stint on the IL, that usually may mean that it's a superficial small clot, which some would teach that that has a low risk of propagation to the lung. If he's out for a much longer period of time, it potentially can indicate he may have a more severe clot, or genetic testing or hematology testing may indicate he's at high risk for future clots, which potentially could be an issue going forward. If you guys recall, Chris Bosh, NBA champion for the Miami Heat, actually had to retire because of blood clots. So, for some people, one blood clot or two blood clots may be a warning that there's something deeper going on inside the body, and this person may be at risk for ongoing clots for the rest of their life. If a person is at high risk for future clots, sometimes they may need to be placed on lifelong anticoagulation or lifelong blood thinners to prevent the risk of blood clots in the future. Obviously, if you're an athlete, the risk of collisions and contact will increase your risk of bleeding if you're taking a blood thinner for life. So, for health purposes, the safer thing to do would be to retire because you don't want to have a major collision and have internal bleeding or hit your head while you're on blood thinners and then bleed into your brain. So we hope this isn't the case for Zach Wheeler. We're hoping that he has a very speedy and full recovery. What do you guys think this means for the Phillies? Do you think this will derail their championship hopes and their playoff hopes? Do you think they will be able to recover having lost a starting pitcher? Obviously, only time will tell. So this is Dr. Claybrooks with Real Medicine. I hope this was helpful and I hope this is informative. Please like, please subscribe, please share this information with someone that you care about. I really like to know your comments. How do you think this will affect the Phillies going forward in the remainder of the season? Thank you again for tuning in. Bye-bye.